morning everybody. I am Dr. Nirmala Agrawal, Medical Director, Juhi Fertility Center near Hyderabad, Sheikpet. So today I am going to talk to you about how to do IVF step by step. So as you all know, IVF is a complex procedure and this needs a very experienced clinician, highly experienced embryologist and a very good lab setup. There are so many parameters which we have to take care to give you a successful result. So now how do we do this IVF? Many patients come and then the myth is that it is a very like the patient what they think it is a very complicated procedure and then you have to take a lot of bed rest. It's a very painful procedure. So I want to clear that it's a very patient friendly procedure, a totally outpatient procedure, and there is no need of admission anywhere except when we do the egg retrieval. The patient has to be admitted for about 2 hours. Rest of the things can be managed everything outpatient, and it takes about from the first day of the injections to the completion of the procedure takes about 15 to 18 days, and after that the patient is free. And then I advise all my patients to do their routine work. There is no need of bed rest at all. This is very important. The patients can resume their activity either at home or even outside whenever if they are working in any office. There is absolutely no need of bed rest. So now how do we do IVF? And when do we do IVF? This is very important. See, what are the indications for IVF? The most important is if suppose the patient has tubal block, and 2, if suppose they have severe endometriosis wherein the blood accumulates inside the pelvis during menstruation as the patient bleeds outside also, the blood collects inside also, and that causes the formation of the lumps, and then the ovaries, the tube, everything will be adherent. So these patients, they cannot conceive naturally. Then third thing is if suppose they have severe male factor. So what is a male factor? Like if the sperm count is very low, or if the motility is very low, or if the sperm is absent, a condition called azoospermia, wherein there are no sperms in the semen. So these patients, we can take out the sperm by a butterfly needle aspiration from the testes and use that and then do ICSI. So ICSI is the only procedure which can help them out. And then what the other indications are, if suppose they have taken lot of treatment outside which has failed, and if they have done multiple IUIs. See, IUIs will be successful only in the first 4 to 6 cycles. Once you have finished 4 to 6 cycles, no pregnancy, better is to go for IVF, because after that the result will be same. So these are the patients we suggest. And then 6th is if suppose the patient is elderly age group, she is beyond 35, she is around 37. So these are the patients, they should not waste their precious time in trying small treatments. So we suggest them to go for IVF, because in one cycle we can give them a 50 to 60% chance, whereas in IUI it may be only 7 to 8%. So these are the following are the indications. Once the patient fulfills all these criteria, then we subject them to IVF. And once the patient is okay for that, then we do certain basic investigations before we start the procedure. So like we do the blood test to know the hormonal level, to know the ovarian reserve level, and then we do a pelvic scan on the 2nd day of the cycle to see how is the uterus, how are the ovaries, are there any cysts, is there any endometrioma, is there any fibroid. So all these things are ruled out in just in one day. And then we do the semen analysis to know how is the sperm quality, how is the count, motility, morphology, everything, whether she can give good result or not, or whether the male needs any improvement. And then we do like the hysteroscopy is done in most of the cases, pre-IVF hysteroscopy. This is to improve the results. If there are any flimsy adhesions, or if there is any polyp, or if there is any submucous fibroid, then we treat that, and then after that we do the IVF. So these are the basic tests to know how is the uterus, and then how is the endometrial lining, how is the male factor, and then how is the ovarian reserve. What is ovarian reserve? The number of eggs which are present in the ovary, which we are going to recruit during stimulation. So if they have very low ovarian reserve, then we put them on certain medications to improve the number and improve the quality for about 2 to 3 months, and then we take them for IVF. If the reserve is good, we can do immediately. And then once we start the process, there are 3 steps in this. First is the investigation. 2 is we start injections to the woman. From 2nd day of the cycle, every day she has to come to the hospital for about 10 to 12 days, and these injections are called gonadotropins, and these are given every day at the same time, and to recruit more number of follicles, because in IVF we want at least 10 to 12 follicles, not less than that, unlike natural cycle wherein only 1 follicle is required. So, the second step, the patient has to come every day, and better to take the injections in the premises, not at home. And then the third is and then every alternate day the scan is done to monitor the growth of the follicles, how the follicles are growing, or we have to use the same dose, or we have to titrate the dose, or we have to add some supplements. And then every alternate once in 3 days we do the blood test. It's called estradiol levels to know whether the follicles which are growing are functional or not. And then so all these things, it takes about 10 to 12 days. Now once the follicles are ready, now we give them a final injection called a trigger, and that is given about 34 to 36 hours before we plan the ovum pickup, and that's how we do. And then for this injection is the most important injection. It should be taken very properly. If it is like, if suppose half of the dose is spilled outside, then will not get any eggs. So patient should understand that this injection is where they take, how they take is very important. Now once the trigger injection is over, we call the patient 36 hours later to the hospital without eating anything. It's called NBM, nothing by mouth, and then under anesthesia we take out the eggs. This process is very simple, it's very painless, it takes about 10 to 15 minutes, and then the eggs are scrutinized in the IVF laboratory by the embryologist, how is the quality, and whether how many mature eggs are there, how many immature eggs are there. All the mature eggs, then these are put in a dish, and then for each one egg we inject one best quality sperm is injected in the oocyte, and then 24 hours later these are checked how many are fertilized, and then on day 3 how many are undergoing cleavage, and then day 5 how many have formed a blastocyst. So in our hospital mostly 90% we try to do the blastocyst culture and blastocyst transfer. That gives the best results. So the first step is injection, second is ovum retrieval, third step is embryo transfer. Embryo transfer is the most important step which determines the success rate. It should be done very properly and very efficiently, atraumatic manner under ultrasound guidance, and it should be done by an experienced clinician, because this is the most important step which gives you success. So once the embryos are placed in the uterus, then the patient is advised a list of medication for the support, it's called luteal support. That she has to continue for 15 days. 15 days later we do the blood test to confirm the pregnancy, and that's how everything is over in 15 days, and after 15 days we do the blood test to confirm the pregnancy. So that's all is IVF. It's not a very complicated procedure, it's very simple, and it takes only 15 days, and the beauty is it gives a very high success rate compared to other natural methods. Here the success rate is around 60 to 70% in the first attempt, and if suppose a patient undergoes second attempt, third attempt, it's about 90 to 95%. So nowadays, because of the improved technology, because of the improved equipments and improved experience and very good freezing protocol, we are able to give very high success rate. Thank you so much.